Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. My name is Dr. Ghulam FAROOQ. I'm adult cardiologist, BAJOUR, KPK, Pakistan, Asia. Well, let's see. I wanted to discuss about the different health problems or diseases throughout the world. I think this lecture should be conveyed to all the peoples who are suffering of any health problem like cardiovascular diseases or corona or diabetes mellitus or joint pains or depressions or some malignancies and loss of hair from the head in anxiety and insomnia and mania and dementia. There are so many health problems in the world. Because why we suffering of health problems, different diseases in the world. At this time, I'm in Pakistan. My age is 53. You can see my picture. My picture is this. Let's see. I will be start from the very beginning. We are so weak in English because my teacher is so good. We have learned a lot from the parents, from the teachers, and from the patients. But if someone have any objection on my English language, I am sorry for that. We are not so good in fluent English and grammatically. I am Muslim. So we should be loved to one another, if someone Muslim or non-Muslim, because we are human beings. So we should be share knowledge with one another. But I promise with you, one day all the human beings, in even animals and some plant, should we follow these instructions which should be given in this lecture at the end. I am trying to keep this lecture just for not more than 30 minutes. I am coming to the first when there is no one aware about the diet, or then some committee was developed that was called gelatin committee. If someone go, because when there is no one aware about the diet, what is protein, what is carbohydrate, what is mineral, what is vitamins, and what is trace elements, and what is electrolytes, and what is lipids. Then after that, let's coming to the first tabib or the doctor who was 15th century, who was Ibn Sina, who was Muslim, who was staying in Samarkand, and after that he was shifted to Qahira, and that was the first Muslim doctor who was, he is the history, he was the father of the medical field. He was a lot of knowledge on astrology and any health problems. Now we coming why there were no such health problems in the world, especially the cardiovascular diseases like acute coronary syndrome, CVA, peripheral diseases, and carotid arteries, especially prematurely before 1930. Actually, now we coming to the heliotherapy. That was 1861, and that heliotherapy were used a lot by the Greece people who were exposing the skin of the boys to the sunlight. They become healthy. Then they started the worship of the sun. The sun is our great God. They providing diet for us. But before that, the Gleason was some European who did a lot of work on rheumatic, but he did not reach it the cause. So he was labeled that is English disease, which is most common in Somerset. And that Ibn Sina in 15th century, and this was 1651. Then penicillin also introduced in 16th century, and that was 1861 heliotherapy. Then in 1921, the McCollum, now we're coming to the discovery of bone vitamin. This is very, very interesting. That was the McCollum who was given butter to the rats. The vision of the rats were weak as a whole. They were not healthy. When they given the butter, the vision improved in the rats become healthy, then the scientists label that butter contain fat soluble vitamin A. When they reheated the butter and they cool and they again given the butter, the vision is lost and the rats remain healthy. So he concluded that this is not fat soluble vitamin. This butter contain just D, substance D. Then there was a lot of criticism on that. Then the Wolf and Doss started the same experiment, given fats to the rats in starch sunlight on the skin. So they discovered that this is bone vitamin and this is sunshine vitamin. They're given just that name. As everyone know, then when the people also starting the same, that is become famous, that is smart vitamin. And then in 2005, the name is changed. Okay, this bone vitamin is actually not a vitamin, this is a hormone, which is a corticosteroid, which is definitely needed for the bone, but there is no cells in the body for which there is no receptor for the bone vitamin. So now we coming again. Also in that is 18th century, who was the Fenson? The Fenson treated the lupus vulgaris as the tuberculosis of the skin, first with the phototherapy, who was awarded Nobel Prize, the same as Wolf and Doss. Now coming to 1884, that was Meridian Conference in Washington DC. The earth is divided into three parts: tropical and temperate and pressure zone. So now we coming to the sunlight, and that sunlight contains ultraviolet B rays, which is 10% in the skin. Now we coming here I am sharing one patient. Actually he's my brother. He's 72 years old, and that was multiple renal stones in 1984, and he lithotripsy a lot in Karachi, SIUT. Then in 2018, the road traffic accident of my brother, and there was 3 hematomas, and he remained unconscious for 12 days in Jinnah Postgraduate Medical Center, Karachi. And thanks God, all the hematoma dissolved without any burr hole, any surgery, and he became conscious. Then that was 2008, and in 2009 he developed anterior wall MI, and he was living in a village, and I was at that time the FCPS student, and someone given thrombolytics actually contraindicated, but thanks God there was no bleed. Then my brother was not stable, and we have shifted to Peshawar because my zone is BAJOUR KPK Pakistan, and there was total occlusion of the ostial of LAD. Then the cardiologist at RMI Institute, he did the angioplasty and put some bare metal stent, and Timiflow 2 is maintained. Then he was because in the road traffic accident also there were fracture in the acetibulum and the scapula. Then someone did some burr hole in the right knee for the traction in Jinnah Postgraduate Medical Institute. So today, look at today is 9 March 2021. Look, these are the right knee joints who was because there was hole in the time for the traction, they developed osteoarthritis, and this is the vertebrae. Thanks God, now the vertebrae is okay. And that was the acetibulum fracture. If you look at this, okay, and these are the bones. Look at these bones, okay. Anyhow, after that he was, my brother insisted for replacement of the joints. Then again I have we have consult the more expert cardiologists in Karachi, in their advice to do the thulium stress for viability. He fit for joint replacement at night. Anyhow, the team decided he is fit, but my brothers is refused. Because we are living in a villages, he think my joint will be replaced, but I will be walk. Then the doctor advised you will be cannot bend the knee joint, so he refused. Now the EF of my brother is just 25%, and he was on guideline directed medical therapy, and he can walk even 4 kilometers with one crunch in the hand. This is the history of my brother. Now we come to the why we suffering of health problems, because as throughout the world, this is very famous, all the research, all the females in the world who are bone vitamin deficient, 60 to 80% people, female, are delivered at the hospital. If someone sufficient with bone vitamin, there is less chances, 400 chances that baby should be delivered at home. Anyhow, any child which is delivered at home or a hospital, the mother milk, everyone know, is deficient of bone vitamin and magnesium. So the word is recommended should be given 800 to 1000 units of bone vitamin daily, or at least from my side 2 lakhs in 20 days. And when the baby reached the age of 5 months, the International Light Association in the world recommend that the mulus area 5-inch skin of the baby should be exposed to sunlight daily up to 15 months. And after 15 months, the skin of the limbs should be exposed 10 minutes daily up to the age of 3 years. Then after 3 years to 8 years, the whole body should be exposed 1 hour for the black people and 15 minutes for the white skin, and from my side I think 45 minutes daily for the Asian skin. But Islam is not allowed to expose the whole skin anywhere, even at home and in the public spaces, because if someone exposing the whole body, there is more chances the jinn, which is the creature of the God, can penetrate inside the human being. So from my side, the legs and the arms skin should be exposed at least 30 minutes and 3 times in a day in the mid-time. As everyone know, the ultraviolet B rays is more at the mid-time when the sunlight on the top. So now we coming. This is the sunlight ultraviolet B rays when they hit the skin. In the skin there is 2 layers, epidermis layer and dermis layer, and in the epidermis layer again there is 2 layers, which is a basal layer and spongiosum layer, and there is 7-dehydrocholesterol. This is very, very interesting. So this 7-dehydrocholesterol is converted to free vitamin D3 in the skin, and after isomerization they come to the liver. In the liver they convert it to D2, and the kidney they form the hormone D, or active bone vitamin D3. Now if someone not exposed the sun, direct skin to the sunlight, the 7-dehydrocholesterol is not converted to cholecalciferol, and there is more chances of hyperlipidemia. So there is obesity and cardiovascular diseases, like especially prematurely heart attack, CVA, PVD, and carotid disease. Now we coming for what is the function of hormone D. As everyone know, they absorb the calcium for the bones, teeth, and every cell of the body, and they properly maintain the metabolism of the phosphate. Also there is magnesium absorption. So when the magnesium become deficient, the baby suffering of autism and sweating and salivation, and the muscle become weak in the adult group. So hernias in the nerves become weak. So there is burning soles, and there is sweating, and here loss in whitening, and the vestibular nerve become weak. So there is dizzy spells, and the cochlear nerve become weak. So there is early deafness, and there is a headache and sweating, and decreased memory, and dementia and mania and autism, and dementia and mania and obsessive compulsive syndromes, and aggressive mood, and the person become panic, and there is phobias and palpitation, sinus tachycardia, and sleep problems and headaches, especially migraine, and bad taste in the mouth, and sweating and burning soles, and loss of self-confidence. And also, as we know, when the sunlight hit the skin, there is increased letitidine and increased lymphocyte stimulation. So that is the against the immune system. But also there is proper use of zinc in the presence of bone vitamin. When the bone vitamin become deficient, there is no proper use of zinc, so the immune system become depressed. So there is tuberculosis, asthma, corona. Now we will come back. What is corona? I will be discuss on that also. So throat infection, so they lead to rheumatic disease and also acute glomerular nephritis, and also there is different types of allergy, and autoimmune system becomes stimulated when the bone vitamin become deficient. So there is some malignancy like colon, prostate, and thyroid, and ovarian, and breast cancer, and also psoriasis and vitiligo and diabetes mellitus, both types from my side, and multiple sclerosis. And as everyone know, when the bone vitamin become deficient, there will be definitely need the body calcium. So the parathyroid hormone, secondary hyperparathyroidism, so the parathyroid hormone is increased, which is called the theft of the bones at the rate which is eating the roots of the tree. Now this parathyroid hormone is trying to maintain the calcium of the body for the cell. So they removed in removing calcium from the bones to fulfill the needs of the rest of the cells except teeth and bones. So the bones become weak, so the world suffering of rickets, especially the Asia, and there is osteomalacia and premature osteoporosis and joints pains, body pains, and so there is a short stature if someone remain deficient of bone vitamin, because the height is not the bone not grow after 16 years. In early deafness is the ossicle, the small bones in the ears become soft, so early deafness. As everyone know, when the parathyroid hormone remain high is secondary to hypovitaminosis D, there is secondary hyperparathyroidism, so there is less reabsorption of calcium from the renal tubule, so they were suffering of renal stone. So as everyone know, when someone reached the age of 16 years, the bone density start to decrease, 1% in the male and 6% in the female. Someone reached the age of 30 years, the bone density loss 12% in the male and 26% in the female. When the female become postmenopausal and the male become at the age of 60, there is osteoporosis. And the world, this is recommendation, when the bone vitamin is increased, one should be given steroids. So a lot, especially in Pakistan, the people giving steroids, steroids is called enemy of the bone. So from my side, one should be not deficient with 75, and as everyone know, the plasma half-life of bone vitamin is just 14 days. And it is very, very interesting because when someone using supplement, the skin should not be exposed to sunlight, because there will be toxicity, and that toxicity lead to renal shutdown and rupture of the vessel of the brain. No one know, no scientists in the world know what is the secret, but the God know all the things, because God sunlight is the free. So now we coming, what is corona? Because the corona is this is the sun or moon. The whitest luminous circle around the sun is called corona. So the world is don't know. So there is lots of money on health problems. So that was it means we are Pakistan, my country is Sunni country, and that is Muslim country. So now we come to the Quran. As we need balanced diet, because the balanced diet actually for the human beings, and according, because there is no good book other than Quran and Rasul, Hadith Rasul, because all treatment are present in these. So as if we take the history, there was special diet Man Salva. That was the special diet from the God. And then the people started to accumulate, then the God banned it. Then the God given special instruction, especially to the Jews, you can eat all the halal things except pork and flowing blood. Then they refuse, they insist to eat the pork. Then the God banned fats of the you can eat now, only eat the fats which is attached to the back of the bones and entrails. And then in the Quran, there is Surah Anam, ayat number 146, وَعَلَى الَّذِينَ هَادُوا هَرَمَنَا كُلَّ ذِي ظُفُرٍ وَمِنَ الْبَقَرِ وَلَنَمِ هَرَمًا عَلَيْهِمْ شَهُومًا إِلَّا مَا حَمَلَتْ ظُهُورُهُمْ وَمَا وِلْ. You can now eat only the fats which is attached to the vertebrae and entrails. You can never eat other fats. So if you want to ban the fats, that is against Quran. And there were special young boys who were called Aswabika, and when they not follow the instruction of the king, which were the Kanus, Then they left that zone and they go to the hill, and there was a tunnel who was sleeping for more than 300 years. But the mouth of the tunnel toward the north and south. So they were safely sleeping, and there were diversion of direct sunlight from the skin. As in the detail of Quran, which is called Tafasir, as they mention, that was the secret of God, that tunnel mouth northward to the west. And there is also a Bukhari book, which is Islamic book in Muslim, Ma asfala min kaveni fi zari fi nar. One can expose the mulilis area of the skin, but not for the female. Now we coming to the Gleason story, and that was about 272 years back. There were 3 health problems in Europe. That were, one was polio, and the second was tuberculosis, and the third was rickets. And that these 3 problems were labeled by the Britain. These are called darkness diseases. Yani the health problems which is not occurring due to not using direct sunlight. In this rickets disease labeled by some Pathan for more than 1,000 years back. I will be using some Pashto words in here. Kamzore mashum de. This is a weak child. And another terminology used by Pathan, sore pe shwe de. This is Pashto words. The objective was Pathan was that there is no exposure of the skin of the baby to sunlight. So now I'm coming, because the sunlight is free. The sunlight is coming from the west and the east, and they're coming to the west. The sun arising from the east and go to the west. It means we all need sunlight, and the sunlight is free. So in Pakistan, the sunlight is very, very safe because no gamma rays. So I'm inviting all the peoples which are using bone vitamin, and because that is very, very expensive investigation, so they can come to Pakistan at least in summer and winter, because in Pakistan there are 2 zones. One is the tropical zone like Karachi and Hyderabad, and from the Attak to Chitral, that is temperate zone. So one can come to Pakistan from June to September. One can enjoy our temperate zone like Swat, Gilgit-Baltistan, Chitral, and anytime come to Karachi, Balochistan and Hyderabad in any weather, because in winter even there is good ultraviolet B rays in Karachi and Hyderabad, because the ultraviolet B rays is very deficient in Norway and Canada, and more common is sunlight contains 10% ultraviolet B rays, which is throughout the year present in Pakistan, especially in Karachi and Hyderabad, but for the 4 months they decrease from the Attak zone to Chitral. So I think I am accepting all the health problems, but not the health problems. I'm sorry, there were a special azan which is inviting the people to come to mass for the prayer, because I'm not accepting all those health problems which is occurring due to not using direct sunlight on the skin, exposed skin of the limbs in arms in summer in the world. I am against total this. I am Dr. Ghulam FAROOQ. Okay, yes, there is health problems which is from the God, age-related congenital problems. But let's see what is the conclusion. The conclusion: so we can terminate, we can prevent, and we can treat unlimited health problem just by using sunlight, ultraviolet B rays on skin in summer, at least 60 minutes in 2 days, especially the day which start from the S, because sunlight is sun, Saturday and Sunday, especially in midday time in Asia. So my name is Dr. Ghulam FAROOQ, adult cardiologist, the first researcher in the field. A safe use, not to burn the skin, safe use of sunlight, ultraviolet B rays on the skin with no diet restriction, and a more cholesterol in diet for 60 to 80 years, healthy, wealthy, and happy life. So the world one day should be changed because the substrate for the bone vitamin is that cholesterol. The people should be starting to eat more cholesterol if someone wanted to make cholecalciferol from the sunlight. Because this world will be changed. My age is 53. We should be not in this world. But let's see what the other scientists follow. What is the key? Because this is the key. No one is thinking why we have sun. Because there is no such diseases in Quran and Hadith. These health problems just due to the human mistakes. So these health problems are due to human beings and humans, not from the God. Okay, as everyone know in the world, the top health problems in the world according to update from the USA, okay, that is cardiovascular diseases, and the second is osteoporosis. But from my side, the most common health problems is the body pains and flu, and the second is cardiovascular disease, because the low age group babies also suffering of pain in the limbs, in joints, in teeth problem. So as everyone know, the diseases is starting from the D. As everyone know, the diseases is starting from the D. Because when the bone vitamin deficient, there will be diseases like diabetes mellitus, dementia, deafness, diabetes mellitus, diarrhea. As zinc become deficient, there is IBS, and dwarfism, and depressed mood, and diarrhea, and the end will be the death. But sunlight, just look on the sun. If someone's full of bone vitamin, that will be smiley, that will be smart, that will be sweet, there will be no sweating, and that will be slim, and that will be sweet, and that will be smiley, and that will be just like star. Let's see what other scientists can do. Let's see, I am happy my brother bone is okay, and the today level of bone vitamin is just 20, because for the last 3 months here is no sunlight. So I will be give 5 lakhs units of bone vitamin to my brother, and after 6 days he will be start direct sunlight on the skin of the limbs. Okay, thank you. This is the Margana. Now there is Premam Namaz. Any question, any objection from anywhere in the world should be appreciated, but I want evidence. Why we suffering of health problems? Why we using medicine, but we are not stable with the medicine? Even some people advising to not eat some diet. Then why acute coronary syndrome occurs second time? Why there is second time CVA? Why there is why is the diabetes occurring? Why the diabetes not terminated with medicine? Why there is painkiller not treat the body pains? Why the depressive people not become stable with the medicine for depression? Why someone develop tuberculosis? Why the second time? Anyone can answer? Should be appreciated if someone give me answer with evidence. Let's see. I am challenged all the scientists should be follow my instruction one day, because every people should be, even some plant making direct D3 from the sunlight, just like tomato, potato, mushroom, and the only animal in the world which is a very, very strong bone, that is fish. Fish not making bone vitamin from the sun, but if we think on the bone of the fish, that is the most strong bone of the fish. Okay, thank you. Assalamu alaikum.